Potassium is like a silent guardian for your heart. It helps to balance the amount of sodium in your cells, which is crucial for maintaining a healthy blood pressure. Without enough potassium, your body struggles to manage sodium levels, leading to potential health issues. It's an essential mineral that helps regulate blood pressure by easing tension in your blood vessel walls. This can help lower high blood pressure and reduce the risk of stroke and heart disease. Getting enough potassium is just as important as reducing sodium. While sodium can increase blood pressure, potassium works to counteract these effects. A diet high in potassium and low in sodium can create a balance that supports heart health. Our bodies need a delicate balance of potassium and sodium to function properly. Most of us consume too much sodium and not enough potassium, which throws this balance out of whack. The optimal daily potassium requirement for the human body is 4,700 milligrams. Excess sodium causes our bodies to retain water, increasing blood volume and pressure. Potassium acts like a natural diuretic, helping your kidneys flush out excess sodium and water. It also relaxes the muscles in your blood vessel walls, allowing blood to flow more easily. So, while cutting back on high-sodium foods, load up on potassium-rich foods like salmon, plain yogurt, and avocados. Potassium has a remarkable ability to directly relax your blood vessels. This essential mineral plays a crucial role in maintaining the elasticity and flexibility of your arteries and veins, ensuring that your circulatory system functions optimally. Think of your blood vessels as highways for your blood. Just like highways need to be clear for smooth traffic flow, your blood vessels need to be relaxed and open for efficient blood circulation. When these highways are constricted, your heart has to work harder, contributing to high blood pressure. This increased effort can lead to wear and tear on your cardiovascular system, making it more susceptible to various health issues. Potassium steps in as a natural vasodilator, widening those blood vessels. By doing so, it helps to alleviate the pressure on your heart, allowing it to pump blood more efficiently throughout your body. As these muscles relax, the blood vessels expand, allowing blood to flow more freely. This improved blood flow ensures that oxygen and nutrients are delivered more effectively to your organs and tissues. By easing tension and promoting better blood flow, potassium helps to reduce the strain on your cardiovascular system. This not only supports heart health, but also contributes to overall well-being by enhancing the function of other vital organs. Including potassium-rich foods in your diet supports healthy circulation and lowers blood pressure. Foods such as bananas, avocados, salmon, and sweet potatoes are excellent sources of potassium. By incorporating these into your daily meals, you can take a proactive step towards maintaining a healthy heart and a robust circulatory system. Remember, a balanced diet rich in essential nutrients is key to long-term health and vitality. What happens when we don't get enough potassium? Potassium is a crucial mineral that plays a vital role in maintaining various bodily functions. It's essential for muscle contractions, nerve signals, and fluid balance. But what happens when our potassium levels drop too low? Low potassium levels, or hypokalemia, can disrupt your body's electrolyte balance. This imbalance can cause a range of symptoms, from mild to severe. You might experience muscle weakness, cramping, or even paralysis in extreme cases. But the effects don't stop there. This imbalance can lead to high blood pressure and other health problems. When your potassium levels are low, your body struggles to regulate blood pressure effectively. This can result in hypertension, a condition that puts extra strain on your heart and blood vessels. Potassium deficiency makes your blood vessels more sensitive to sodium's effects, increasing the risk of hypertension. Sodium and potassium work together to maintain a delicate balance in your body. When this balance is disrupted, it can lead to serious health issues. It can also disrupt your heart's rhythm, weaken your bones, and increase your risk of kidney stones. An irregular heartbeat, or arrhythmia, can be life-threatening if not addressed. Additionally, low potassium levels can lead to bone loss, making you more susceptible to fractures and osteoporosis. The good news is that potassium deficiency is preventable through a healthy diet. By incorporating potassium-rich foods into your meals, you can easily maintain adequate levels of this essential mineral. Foods like bananas, spinach, avocados, and sweet potatoes are excellent sources of potassium. By ensuring you're getting enough potassium-rich foods, you can maintain electrolyte balance and keep blood pressure in check. The recommended daily intake of potassium for adults is around 4,700 milligrams. That's roughly the amount found in 7 large avocados, but you don't have to rely on avocados alone. Leafy greens, colorful fruits, beans, and lentils are all great sources of potassium. Beyond avocados, there's a world of potassium-rich foods to explore. Fruits like bananas, cantaloupe, watermelon, and oranges are excellent sources. Vegetables such as spinach, sweet potatoes, and beets also pack a potassium punch. Dairy products, fish, and legumes like lentils and chickpeas are great options too. Enjoy a variety of these foods throughout the day for ample potassium and other essential nutrients. Potassium supplements are available, but they're not a magic bullet. Getting nutrients from whole foods is always the best approach. Foods rich in potassium provide a symphony of other vitamins, minerals, and fiber. High doses of potassium supplements can lead to dangerous side effects. Talk to your doctor to assess your individual needs and determine if a supplement is appropriate. Focus on a balanced diet with potassium-rich foods for the best health benefits. While potassium is crucial, moderation is key. Excessive potassium can lead to hyperkalemia, disrupting your heart's electrical activity. Symptoms include muscle weakness, fatigue, nausea, and chest pain. Hyperkalemia is uncommon in people with healthy kidneys, but can be a risk for those with kidney disease or certain medications. If you experience symptoms after consuming large amounts of potassium, seek medical attention. Consult your doctor to understand your individual potassium tolerance. Some people need to be cautious about their potassium intake. Individuals with kidney disease must monitor potassium levels closely. Certain medications can increase potassium levels, so talk to your doctor about your intake. Older adults may also be more susceptible to high potassium levels. As we age, our kidneys become less efficient at filtering potassium. Consult your doctor to determine the appropriate potassium intake for your situation. Navigating nutrition can feel overwhelming, but your body sends signals about what it needs. Pay attention to how you feel after eating certain foods. Tuning into your body's cues can provide valuable insights into what nourishes you. Seek guidance from your healthcare provider for personalized recommendations. There's no one-size-fits-all approach to health. Combine your body's wisdom with your doctor's expertise for a personalized plan. The journey towards healthy blood pressure is about sustainable lifestyle choices. Incorporating potassium-rich foods into your diet is a delicious way to support heart health. From vibrant fruits and vegetables to hearty legumes, explore the possibilities. Small changes can make a big difference over time. By making potassium-rich foods a regular part of your diet, you're investing in a healthier, happier you. Like, share, comment, and subscribe to Remedy Seeker for more health tips and remedies. And we will see you in the next video.